Well, thank you, Amber. And I would say nice to see you all, but obviously from my end, I only just see names. But I'm excited to be here and share with you one of my passions, one of the tools that I have fortunately learned over 18 years ago, and I've been clinically practicing it for over 16 years now. The goal is to brief you a brief summary, a little bit about dry needling, a little bit about how I'm implementing it, who I use it on, a little bit about how it works, and a little bit about how you can implement it in your clinic. And then obviously leave the rest of the time for questions. But as Amber said, if there's any questions any time through this presentation, is an interactive presentation, please do not hesitate to share, just speak. As a matter of fact, you don't even need to raise your hand. Um, so, as Amber said, I'm a Logan graduate, 2009 December. I learned early on about dry needling from Dr. Kettner, who would present to us his research about neuromodulation with pain and how does the brain act under functional MRI during filament insertion during actual acupuncture or dry needling. That's where my curiosity started uh, almost over 20 years ago. So with that, I developed that curiosity and I wanted to learn more. Subsequently, I originally learned acupuncture. I did over 200 hours in acupuncture, and shortly after that, I learned about Dr. Ma, who was one of the pioneers in bringing in the medical aspect of dry needling or medical acupuncture to physical therapists, to chiropractors, and so forth. So I studied directly under Dr. Ma for many hours. And then since then, I've been practicing. The history, though, of dry needling started even earlier in the 1900s, where different European practitioners will talk about muscle fiber sensitivity, muscle tension, trigger points. Briefly after that, you're all aware of Travell and Simon that mapped the body for trigger points. And that's where we became aware of trigger point injections. And shortly after that, I'm sure the name Carl Levitt is a known name in the chiropractic community. He coined the term dry needling. He realized that patients were getting better when those trigger points were not just injected with a chemical medicine, even the mechanical function on the trigger points was actually given results. So hence the of the word dry needling. So now they're needling those injured tissues without administering a chemical or a medicine, hence the word dry needling. Subsequently, after that, things became more popular in the US among physical therapists and chiropractors, and including Dr. Ma popularizing it. So that's a little bit of a history there. Um, so I imagine you're here not because you're curious if you can learn it. I'm quite confident you're going through much harder stuff during school and the boards to learn it. I believe you're here more curious about how can you implement it. Could you be reimbursed? Is this worth your investment? And then what would you do with it once you learn it? And that's what the goal of the conversation today. A little bit about me again. I've been practicing for over 16 years. We have multiple doctors work with us at multiple locations. When I started dry needling, there was not even a code, a CPT code for dry needling. Luckily, at the time, I was acupuncture certified, so I was able to practice dry needling under the umbrella of acupuncture. I've been fortunate, worked on multiple elite athletes, and of course, I treat a gamut of patients in the clinic. And I have been fortunately training doctors with dry needling among clinical expertise for over 12 years now at the clinic. These are some of the people that I have worked with. Some cult players. These are just this past year. Before the season, the NFL season ended. Some from Chicago Bears, some from the NFL. Cody is a world champion in his weight. And I'm currently the Fever. Maybe you've all heard of the Fever, the Women NBA. I'm their team chiropractor. And I've been fortunate to see a lot more of what you see on the screen at the clinic. Uh, so if you are curious, what is dry needling? Dry needling basically is a thin filament that we insert in trigger point, a muscle adhesion, muscle tension, fibrotic muscle tendons even, and we create a micro lesion. That micro lesion creates a signal to the brain, whether it is a biochemical signal or an electric signal through the spinal cord at a segmental level or ascending fibers to the main central nervous system. What that does after you insert a filament, it creates a cascade of healing. One of them is resetting the muscle fiber. We'll discuss that a little bit later, but that definitely and sometimes even immediately during the treatment, you notice the tissue release, the trigger point disappear, the range of motion increase at the patient in the patient's symptoms. So definitely there's a central pain modulation, and that's how the body starts to heal. I tell my patient with those insertion, the body activate natural and biological healing processes. On a tissue level, what research show that the insertion of a filament, just inserting a foreign body into the tissue activates positive inflammatory cascades. It also increases the blood flow to the area. There is vascularization to the area, and as we all know, with more blood flow to any tissue, specifically injured tissue, there is more healing. It also elicits a microcurrent of injury, as you might remember from physiology. That's where those electric signals are telling the brain, telling the nervous system, this tissue is injured. Send what you need to send to the area to heal the tissue at a local level, not just shutting down brain pathways or modulating pain. On a neuromuscular level, what we see happen at the motor end plate, there's a release of so basically, as you remember from schooling, the nervous system at the end, it's connected to the muscle fiber, the spindles or the sarcomeres, and that end plate, sometimes it is always firing and not allowing the tissue to stop activating. So that motor end plate become dysfunctional, and that's how those trigger point at times exist. We look, as you palpating, you find really heavy adhesion, commingling of the fibers, and with that, as you know, there's decreased blood flow, there's inflammation that happen. So when you insert that filament in this segment, you disrupt that activity from the nervous system into the neural junctions there. And I'm trying to put this on mute. I thought it was on mute, and now it's on mute again. Also, you might have heard of the local twitch response. This is a reflex. That's where when the filament is inserted in the middle of this trigger point, it creates a reflex, literally a segmental reflex, where you'll see the tissue twitch. That also is another release of spasm, tension, and decrease of activity and normalization of the tissue. On a central nervous system level, we discussed the segmental modulation. When the information comes in through the C fibers and other afferent, the interneurons automatically starts to decrease the nociception and then the feeling, the sensation of pain, but also at the same time it sends afferent information up into the nervous system, the central nervous system, and the brain activates the controlling pathway of the pain, descending inhibition and neural inhibition of the pain. So this is just a very brief explanation of the different ways that the filament affect the tissue at a local level at a segmental level and at a para segmental level, at the central nervous system level. We can come back to that and explain it more if needs to be. But some of my doctors ask me, does that replace adjustments? Not at all. As a matter of fact, our clinic specifically is an integrated clinic. Our clinic utilize dry needling in conjunction with soft tissue, any form of myofascial release, and then we combine it, of course, with an adjustment, and we actually wrap up our treatment with a form of functional rehab, physical rehab. So it's good. It basically adds value to the adjustment that you're going to be delivering. The question is always, okay, we learned this. You attend this June and July training program at Logan, and what do you do Monday? That was the question I had over 18 years ago when I started this, and 16 in the clinic, of how do you integrate it? How do you explain it? At what point do you administer it? How do you charge for it? How much can you charge for it? Do you bill it? You don't bill it? A lot of those questions that I personally had. You can integrate medical acupuncture or dry needling in any of your clinical settings. If you enjoy adjustment alone, this adds to your adjustment in a simple way. It releases the tension around the segment that is fixated and allows your adjustment to be much smoother and easier to deliver, and the outcome is better. If you are a rehab-based clinic, the medical acupuncture allows the tissue to normalize, the tone to release, allows the tissue to adapt to whatever information you want to put into it, a core rehab or a shoulder rehab or any form of a rehab program. If you're soft tissue geared, if you're big into ART or Graston, with our fingers we cannot reach deeper layers. Sometimes those trigger points are really deep. And also with our fingers we cannot create and elicit the all of the function that we mentioned earlier, particularly the twitch reflex and the disruption of the motor and motor plate, or even performance setting. As you can see in my photos, we've seen a lot of athletes that purposefully seek dry needling, and that's one of our differentiating factors. If it's not in the slide, we can talk about it a little bit later. Something I invite you to think about: how would you go about differentiating yourself as you are currently practicing, or if you are about to practice in a future clinic? So now you might ask, okay, I can adapt it, I can see myself doing it, but how do I communicate it? And then would the patient pay for it after all? And so I always encourage the students that I or the doctors that I work with that first think the value you're going to bring, the perceived value. When you internally align with yourself, knowing you have an additional tool in your hand that allows you to decrease pain rapidly, normalize tissue tension, decreases spasm, decrease adhesion, you naturally become more confident with yourself. And with that, you're able to naturally communicate what you're going to do to the patient. The patient sense your level of comfort, your level of confidence. And that's level one. You need to be confident with what you're about to explain, because whatever you explain, whatever recipe anyone will give you to verbalize, if you're not internally confident and you know this is a tool that helps, there's no prescription or a verbal communication that anyone can give you that you can go out and really deliver confidence to your patient. So that always starts that you have to be very well centered, and that's what I coach my teams, that I at any time I have coached, to allow them to communicate the value of medical acupuncture or dry needling. But with the right communication tools and skills, you can definitely deliver the verbal value at first to the patient. And then quickly, within even a visit, most patients within a visit, they're finding increased range of motion, decrease in pain, decrease in tone, if not within first to third visit. So patient communication is key to allow their nervous system now to also accept and understand what's about to happen. And on that note, what we also notice in our clinics that at this point, patients are seeking it naturally. So it's not years ago when I'm about to graduate, there was a lot of word about how to sell. We don't even sell anything at the clinic. We just present the value and we tell them what needs to happen, and that's where we leave it with our patient. I'm happy to share an example on that. Important things to consider, which we also cover in our training at the Logan, are practicing it in a safe way. With our training, we will definitely cover all of this: the aseptic technique protocol, clean technique, understanding the anatomical space that you are treating, to what depth and where and what angle to approach. And lastly, proper supervision. In our program with Logan, we're keeping it at a small group. So this is something that you need to think about. If you need to do that, jump on it quickly because it's limited seating. I think Amber either 20 or 25, but we were keeping it super small group on purpose because I want to be involved in the observation of every student there, or participant, I should say, because some of you might not be student at this point. The one risk I can tell you is inadequate training. If you don't have the proper training, proper participation, this is where I have seen where practitioners could make an error with their treatment. Market positioning, I mentioned it a little bit earlier. What we see currently I'm in Indianapolis. What we see in Indianapolis, there is a direct search online on Google business pages, people seeking medical acupuncture or seeking dry needling, particularly athletes who have heard it from others, and know the value of tissue normalization for them. They need to use those calves or quads or whatever in a capacity that is elastic, and they cannot afford playing in the game with contracted and adhesed tissue. But also, from a market positioning, you set yourself apart where, why do they want to come to you? Well, one of the reasons I tell our patient that our differentiate, why people choose to come to us, is our integrative approach. We do integrate. Instead of going to 2 or 3 or 4 different specialists, you will get those therapies with us in one visit without having to go to multiple places to address the different aspects of your pain. So with more outcome acceleration, patients love to see them getting better. They will be your billboard, your biggest referral, as we both know, or as a matter of fact, many of us know. And here, word of mouth is a very important level of growth in your clinic. So patients feeling better, they see your value, they're going to tell their family, they're going to tell their friends, you're going to grow your clinic and retain patients in a better way. Return on your investment. Again, another question you might be asking is, what is the investment in the first place? But two, what is the return on the investment? The return on the investment, in my opinion, is beyond a financial return. We will discuss that in a moment. But first, think about your emotional return, where you know you have more confidence, where you know that you can help patients with musculoskeletal pain beyond just a paraspinal subluxated joint. Return clinically, where you have more patients that been referred to you, or they come back and want your help with other body part. Hey, you fixed my neck pain. Can you fix my calf? Can you fix my plantar fasciitis? Can you fix my tendinopathy, my tennis elbow? So you can quickly see the benefit of that. Financially speaking, what we see in the market, the pricing of a dry needling session is anywhere between 40 to 120, depends on where you are located. In Indianapolis, I started again, as I mentioned, 16 years ago, we used to charge $35 16 years ago for the dry needling session. Today, we charge $98 for the dry needling session. So if you do the math, let's assume you're an average market and you're starting, you want to develop the value to feel you can charge $98 or $100 for a dry needling session. Just call it $50. Even if you do 2 sessions per week, that's $100. And even if you just do it for 50 weeks, not even additional weeks, that's $5,000 right there. That pays double the amount, if not double and a half, of your investment. So the return, financial return, is going to be in folds and of what you will invest within even just the weekend of the training. Now, if you might ask yourself, would I continue doing this, or why some other practitioners, if you heard somebody did it but did not continue doing it, it's just like anything in life. If you don't appreciate it and you don't practice it often and you don't recommend it, you're gonna wear out of it. You're not gonna find the love in it, the passion in it, the expertise in it, and you're gonna just slowly shift out of it. You'll get so many reviews. This is just, I asked my team to give me just a few reviews, but you'll get a lot of reviews that are specific for dry needling purposes. After one drilling appointment, I had relief, and you will get a lot of the after one visit, I had this immense relief. So just a brief amount of reviews to kind of reinforce that. So as we mentioned earlier, the Logan University will be holding a training that will be 50 hours. 50 hours is key because most of the boards in the different states are requiring 50 hours. Of course, end of the day, you need to reference back your specific state. But in my case, for instance, Indiana is a 50-hour. To my knowledge, majority of them are 50 hours. It's a 2 weekend, a Friday, Saturday, Sunday, and it's extensively hands-on. We'll talk a little bit about theory, we'll review the muscles, we'll review what we need to do, but this is not an anatomy class, this is not theory class, this is hands-on practical class where not only we're going to learn how to needle, angles, direction, depth, what not to do, what to do, but more importantly, we're going to talk about kind of protocols. Okay, if somebody presents with headaches, what do we do? Somebody presents with a functional impingement, shoulder pain, what do we do? Somebody presents with sciatica, what do we do? Somebody presents with classic low back pain, what do we do? Somebody presents with calf pain, Achilles tendinopathy, what do we do? Somebody presents with an IT band syndrome. So we're not gonna just learn how to properly and correctly and ethically administer dry needling. We're going to also learn protocols on that. So the dates are June 12th through the 14th, the first weekend, Friday, shorter hours, Saturday, extended hours, Sunday to mid-afternoon, so you can fly back, travel back, get back to your clinic or back to school. And the second one is July. Again, it's very important you check for the scope of practice with your specific state and your specific board. Usually the language around that is simply complete those specific hours. In Indiana, all you have to do is complete those specific hours. And as a matter of fact, NCMIC also, that's part of your coverage. If it's approved by your board, you're covered automatically. So that's a little bit on that. I'm all ears. I'm excited to take your questions and answer anything you have on your mind.
All right, all of you should be able to unmute and ask any questions that you would like. So we will open it up for you.
Yes, Scott. You might be muted. Looks like you're muted, Scott.
Can you hear me?
Yes.
Jerry, I can hear you. Yes.
Okay. How long does a typical session take?
Great question, Jerry. The way we practice our model of dry needling is a very thorough approach. We don't just uh, go after a one localized trigger point. In years of practice, we realize that let's assume you're working on a trap muscle. We realize that the trigger point are not localized just on that most superior aspect, central aspect of that trigger point. We've seen that sometimes along the fibers there's other areas of tension. So we dry needling the rest of that space. Some practitioners like to also add the tens unit to that. So the short answer, it could be anywhere from 5 minutes to 20 minutes. Depends on the body part, depends on the area, depends of the extents involved in it. But that's basically anywhere from 5 minutes to up. Usually it's no more than 15 minutes, but that's basically where you can find yourself spending the time doing it.
Can I follow up with that?
Please.
Um, is that something you have to stay in the room with, or not?
Great question. Early on, Jerry, I used to put the filaments, I used to turn the TENS unit on. I would give them a pager and I will let them focus on breathing, calming down, just relaxing. And then I will go finish a quick note or discuss something with the next patient or whatever you needed to do or take their note immediately. But in the most recent years, I have been staying in the room and I have been working around the TENS unit, above it or below it, scanning additional tissue for additional thoroughness, especially if I'm working on advanced athletes and those. But no, you don't have to stay in the room. You can, because that is not a timed procedure, Jerry, by the way. So, as Dr. Ma, my instructor 18 years ago, would say, you can put the filament, take it out, you did the job. So it could be as simple as that, and it could be as more involved as up to 15 minutes. You can decide to what level you participate, but it is not a timed procedure.
Okay. Thank you.
My pleasure.
I have a question for you.
Hi, Lakita.
Hi, so I currently practice acupuncture, and I was wondering if you ever combined your dry needling with acupuncture, because I have a lot of my patients that ask if I do dry needling, but I don't. And then I have to explain the difference between acupuncture and dry needling. So I was wondering if you ever, on a patient, combine those two.
So early on, I did combine. Here's an interesting fact. 92 90% to 92% of trigger points are actually on acupuncture points. So naturally, by addressing the trigger point, you're already commingling, if I should say, the benefit of the acupuncture along with the dry needling. So there's already a mixed effect from simply doing the dry needling on the patient that has the background of acupuncture to it. Recently, in the most recent years, I have been practicing more of the dry needling uh, because I'm able to go a little bit deeper and address a little bit more the trigger points and the adhesions than just traditionally speaking, staying more shallow and more on the energetic pathways, which has phenomenal benefit by itself, no doubt. But given that my practice is a little bit more musculoskeletal oriented, I have been seeing much more benefit there. And then in your case, if I may suggest, maybe you can pick and choose depending on what are the patient symptoms and what are you treating. And if it's more musculoskeletal, maybe I would recommend a little bit of the dry needling approach. And if it is out of the musculoskeletal realm of treatment, maybe the more of the acupuncture approach.
So then follow-up question,
Please.
with your pricing, since you said you do adjustments, dry needling, and then they do rehab and then they leave, is your pricing all encompassing, or do you break that out? Like, say a patient doesn't want dry needling that day, or is it just like one price, it includes everything, and if you get it, you get it, if you don't, you don't?
Great question, Lakita. The way our specific model is positioned, we are an integrated clinic. For our musculoskeletal patients, I tell the patient, I need to affect your tissue. If I do not affect your soft tissue, the adjustment is gonna be harder, and it's gonna be harder to deliver and then quicker to go away. I need to hold the adjustment. So I need to affect your soft tissue. So we do and I need to affect your soft tissue even at a deeper layer. So that's where the medical acupuncture is going to help me take the spasm, the tension, the trigger points out. I'm going to complement that with the soft tissue to help with additional vascularization, tissue release. Of course, I'm going to adjust you then. So now I have a better chance at getting better adjustment, and the tissue is not affecting the joint positioning. Lastly, we need to do physical rehab. Whether it is a shoulder case, a low back case. Let's take a classic, because majority of our patients are low back patients. Let's assume through our testing we saw deficient core. For me, I tell my patient it's unethical for me not to put you through a rehab session to tell you how to mitigate it on your own, from soft tissue aspect, foam rolling, trigger ball like a lacrosse ball, and breathing and core activation. So the way we positioned ourselves, Lakicha, is an integrated approach. It's about a 40-minute session. And that's how we have positioned ourselves in the market, and that's what patients come to us for. So it's not a la carte. Now, weeks, months later, the patient knows their rehab, knows their dead bug, bird dog, side bridge, whatever they are that we've put them through. We may be potentially able to drop maybe a unit of rehab or two. But to answer you, the way our model is, it's an integrated model, and they pay for each of the services, but of course in one fee. So to proceed with that, our patients pay anywhere with insurance about 190, 195 per visit. If it's out of pocket, about 220 per visit. And but again, for us, we proceed with value. We deliver the value, and patients love getting the treatment. So we don't break it down. We don't lead by choice. Early on, one of my early mentors, I started my career maybe 17 years ago, he said, Charbel, if the patient knew what would get them better, they will not be in your clinic anyway. They'll be doing it. So you have to provide the patient this direction, this approach, to tell them what they need the first few visits. And when they see the value, they obviously trust you more, and then you can change. But for me, I feel like I cannot give the value they need, the pain decrease they need, the outcome they need, without me combining the dry needling with other services, Lakita. So thank you for asking that.
Thank you.
My pleasure.
Hey, Jerry has his hand up.
Yes. Are there any contraindications to dry needling, and what is the most common side effect or negative reaction?
Great questions. Of course, the first one is the biggest two are if a patient is on blood thinners. And with that, we have obtained in the past a clearance from their cardiologist or their primary physician. But remember, the filament is so thin, and most times you're staying in the muscles, you're not coming deep into big arteries. The other one is adding TENS unit to pregnancies. We will not be obviously adding a TENS unit to a pregnant population. Some side effects, Are on a local level, you'll see the simple ones are bruising and or soreness. From there, you'll see at times where the vein puffs up, the tuna indica that it dilates, it creates a little puffing. You'll see like a little bowl, a little pea formation, and that goes away within 2 hours to 2 days. Sometimes you see redness, irritation, like a form of inflammation on the skin. That typically goes away within 2 hours to 2 days. We've of course experienced vasovagal response, patients who have a little bit of anxiousness around the filament and they have syncope for maybe 2, 3, 5 seconds. Those are to what comes to mind that I've seen in the clinic as a side effect that are not necessarily favorable, but these are all very transient side effect. Fortunately, never a permanent side effect.
Thank
Oh,
you.
I forgot also, Jerry, there are some, uh, I've personally never experienced a pneumothorax. I've been hired a couple of times to defend pneumothorax cases. I feel honestly pneumothoraces are a, coincidental at the time of the filament. But of course, if you're dealing with a patient that's a petite frame, female, let's assume, and you're working around, let's assume, the rhomboids or the serratus areas, of course you want to exercise your best practice to stay very shallow in those muscles and obviously not penetrate an inch or a 2 inch filament through and risk puncturing a lung. But if you exercise yourself properly, you should never run into that.
Thank you.
My pleasure. Thank you for asking. Welcome all your questions. I know you have more questions. Some of other ones. It's good to ask them here and not leave thinking of I wish I asked this. Maybe I can ask you that. Maybe one of you can answer me. What would hold you back from adding a dry needling to your clinic? What's the hesitation in your mind that would say, I don't know if I can do this or if I want to do this? Yes, yes, Gerald? Yes, please. Or is that Jeremy again? The names are over each other from my end, so I have a hard time distinguishing who's raising their hand.
Oh, it's me, Jerry, again.
Please go ahead.
So my only slight hesitation is typically I see patients every 15 minutes and I always stretch them. I always go over exercises each visit. And the way I do that, I just don't know if I could incorporate more time.
That's a fantastic question, Jerry. So it's going to depend on your approach. One approach could be, look, I'm seeing those patients, they're getting better, they're fantastic. I don't need to do anything else. Fantastic. Now you might tell yourself, well, I have 10% or a certain number of patients that with what I'm doing, I'm not getting the relief. They're not happy with the progress. They keep on coming back with this, or they're saying, "Hey, what else can I do, doc?" And you might not have that, but let's assume you have that percentage of patients. That's where I would recommend, as you're scheduling them, whether you're doing it yourself or your front desk, to say, "Okay, you're gonna become a 30-minute patient." And now in this next 15 minutes, we're gonna do dry needling. This is how we're gonna help you bypass this roadblock, this challenge, this stubbornness of your pain. And you do that for, let's assume, 4 visits, or maybe not even more than 6 visits. Most patients resolve in 3 to 6 visits with their musculoskeletal pain. You can go back to your traditional approach. So it doesn't have to be one way or nothing or all patients. You can, at that point, make it an added to the patients that are that are stubborn, or if it's true deep trigger point in a tissue that you're not able to reach it just by stretching that. So this is at least one way that you can consider incorporating for better outcome should you have a small percentage of pain, stubbornness in patients.
It makes sense.
My pleasure. I appreciate you asking. This is what's good that you can, because fortunately, I have a lot of years of experience. I've trained a lot of doctors from different backgrounds, some recent graduates, some that. So I fortunately worked with this for years, and I can help you navigate the thoughts in your mind or the roadblocks in your mind, and I can propose an experience that I've shared. End of the day, you guys decide what's best. But I'm happy to at least propose solutions and share true experiences that we've come across. Yes, please.
um, are there any additional costs other than the filaments?
At your clinic, so cotton swabs, alcohol, the filament, disposable containers for the filament, small ones. They're like, I don't know, $10 on Amazon. Um, very, 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 very insignificant financial cost on that. That's all I can think of.
Thank you.
Pleasure.
Does your insurance cost any addition if you add something like this on?
No, no, the same insurance cost we've maintained this no. I am with NCMIC. From NCMIC perspective, that's in your board of, it's part of your practice, and it doesn't require you to add anything. On the insurance, if any of you does car accidents, MedPay pay for it in full. So we see a small percentage of our patients are car accident patients, and we do bill medical acupuncture and those treatments, and MedPay does cover that. Or a certain percentage is on liens. Also, when we send the ledger to the attorneys, that is never negotiated. Some insurances say they cover it, but they don't actually pay, so that's most of it is an out-of-pocket reimbursement. But definitely on the car accident side, it's an added benefit to the patient, to you, and it does help, especially with those acute stages with heavy spasm, whiplash, whether it's cervical or lumbar. It's a phenomenal tool. What other hesitation? So Jerry brought one hesitation, which I'm grateful for your thoughts and questions. Anyone else is thinking of, I would like to do it, but
I guess I'm trying to figure out how to implement it into my practice. I'm a one-woman show. I work from home, and all my services are kind of a la carte. And so I'm just trying to figure out how it fits into the scheme of things.
I love it, Lakita. So when I started, I was by myself for a few years. I would answer the call, I would check patients out, I will do the marketing, the billing. So I understand where you're coming from, and I did that myself for a few years. I would suggest, similar to Jerry, in your case, if you want to keep the same approach, that's what you're comfortable with, that's what your patient knows. All you can do from your end is, from a confident place, tell them, in this specific case, the trigger points are deeper. This is a tendinopathy of some sort, or a trigger point in your calf, or a trigger point in your pectoralis, or a trigger point in your cervical extensors causing you those headaches. And traditional acupuncture, which allows you to stay shallow at the trigger point at the acupuncture level meridian, it's helping energetically, but it's not letting me really reach that trigger point deeper, and not allowing me really release that tension and improve even more the blood flow to the area. And that's basically, truthfully, what it is. And patient that at this point trusts you, should simply say, I trust you, and this is what's going to help me. Let's do it. And the best part is when they do it, visit or two, they're gonna look at you and be like, wow, I'm so grateful I did this. I don't know how else. And what's also neat about the dry needling, when you are going deeper past the energetic space of the acupuncture points into those motor end plate, and the patient feel those twitch reflex that they have not experienced with acupuncture, that's where you're also reassuring them with like, this is why I recommended this approach. But the results speaks usually for themselves, and you will enjoy having an added tool, especially that you're comfortable with the acupuncture filament, and that and your patient comfortable with a la carte and those. So for you it should be a super easy added tool to say, well, this is also being a little bit stubborn. And funny also, Dr. Sang here, she's in Fisher. She's a traditional acupuncturist, and there are many cases where at times patients come and see me after seeing her because the true musculoskeletal cases that she's having a little bit difficulty with them, that fortunately dry needling can, and then they go back to her. You can go back to traditional acupuncture if that's what they afterwards. So that's how I would envision you incorporating it in your practice.
And how often do you do it? Because you said it usually gets better in about 3 or 4 sessions.
Yeah.
Is this like once a week, or you do it twice a week, or is it once a month? What does that look like?
A majority of our patients are 2 times per week, and usually the results are seen between visit 3 to visit 6. They're already 30 to 50% better. Many of them, even within visit 1, 2, or 3, they're already 80% better. But we don't like to tell that to the patient. We tell the patients, give us 6 to 8 visits and you'll see the results. But most of them report resolution within 3 to 6 visits. But we always recommend 2 visits per week, or reassess as we go. We have that conversation always going. But traditional musculoskeletal pain, they resolve like this tool. I tell my patient, if you tell me to do one thing, it will be this and adjustments, and for the rest of my life. It's such a powerful tool.
And so are you also adjusting twice a week?
Yeah.
You're doing the whole thing twice a week.
Yeah, when a patient comes to us in an acute space, for us, we do the entire integrated approach, dry needle, soft tissue, adjust, rehab. When the patient reach 80-90% improvement, in our case, we drop them off to once a week, maybe for a week or 2, and then 3 weeks out, then maybe a month out. At that point, most of our patients have full resolution. And then many of them, they might come once a month. Some I don't see, honestly, for 8 years. Jordan, I just started back with his shoulder pain. I treated him 8 years ago for hamstring. And then he came 8 years ago for shoulder pain. And similar situation, his shoulder pain is almost resolved in about 6-7 visits. So the resolution, it's so rewarding too when you have those patients that they have tried other forms, including chiropractors sometimes, and this is what's really given them the advantage, and that will give you hopefully the advantage to also set you apart and differentiate you in your community of practice.
Awesome, thank you.
My absolute pleasure. Anybody have a question about maybe the seminar itself, location, timing?
I think William has a question.
Yeah, would love it.
Yes. I have a question. What about patients with have chronic lower back pain? You know, that they've been having pain for years and they come to your office.
Yeah, William, the studies have unequivocally proven that medical acupuncture is phenomenal, specifically for chronic back pain, because the insertion of the filament in the tissue reactivate healing processes. Sometimes when injuries or muscles are tight, fibrotic, injured, the nervous system forgets about them and they're chronically in those states. But when you introduce the filament to that space, you reintroduce a message to the nervous system to say, hey, you've forgotten about me. Come down, bring blood flow, restructure the tissue, bring fibroblasts, get some fibers, ligaments, blood flow to the area, and yeah, restructuring that the thalamic pathways, the pain pathways. So there's all kind of research specifically on chronic pain for and usability of dry needling in chronic pain.
So follow up, what would be the number of treatments with a chronic pain patient? You know, the acute patient, you said there was a certain range. Is
So
it different with the chronic patient?
great question, William. That's the magic about dry needling. When I deliver this to my patient, fortunately, again, as I mentioned, I have over 16 years of clinical practice and a few others during schooling and thousands of patients. I tell patients, traditionally speaking, majority of our patients between visit 3 to 6, they're 30 to 50% better, and 6 to 8, they're already 80 to 90% better. And 90% of the patients fall into that bracket. There's hardly ever those would require a little bit more. But when they do, at that point, William, you have to remember that the patient have already been seeing values, seeing progress, seeing decrease in pain that have not experienced before. So for them at that point, they'll say, okay, so what? 2 more visits and I'm feeling that much better? You're phenomenal, William. So specifically after visit 3 to 6, where that majority of that relief has taken place, patient will have no problem at that point saying, okay, you're not ahead of the treatment plan, you're just at it, and we might need a couple of more visits for completion. And that's basically what we see in our case.
Thank you.
My pleasure. Thank you for those questions. I'm sure some others had those questions and did not want to ask or how many maybe by a show of hand and Amber can help me see the rest of the screen. How many are students first, if there's any student joining us today? And Amber, you can help me with the count of hands if there's any students today. Will be great to see how many hands go up. You're unmuted, Amber.
It doesn't appear we have any students.
Oh, okay. So we're all practitioners. That's you know, I love practicing, and every clinic has its own culture, its own vibe, its own approach. But definitely, as we're going through our training at any time during the training, to questions about how you think I should position this, how you think I should incorporate Google business page, how you think I should incorporate my SEO around it, how you think I should advertise for it. Those I'm happy to answer during course breaks, before session starts, end of sessions. I don't want you to think that I'm really passionate about this topic. I love helping. That's my nature. I feel my purpose in life is healing, teaching, and guiding, and I'm fulfilling with this one of my life purposes by teaching and also guiding. If you're curious about, how would you verbalize it, and well, we will do that during the course. I will be taking some of the audience as patients with your actual pain. Some of us have, even if you don't have pain, let's assume you would have had that pain. Well, I will personally be working on attendees from this course as my own patients. How I would listen to you, how I would ask you questions, how I would do the actual practice on you, what would I would tell you what to expect, how I would explain to you how is it working. And so it is beyond just hands-on. There's a lot of guidance. So when you go into your practice on Monday, this is not just, okay, I learned really well how to do this, but through my demonstration of how this technique works, I'll be communicating how you communicate that to patients. So you're going to be well guided through the training as well.
All right, we'll give a couple more minutes for questions and then we'll go ahead and wrap it up. So anybody have any last minute questions before we
If you have any questions, don't hesitate to, of course, reach to Amber, reach to me. Amber can share my email address. We'll also have another session. I believe Amber scheduled one more for us to have those kind of conversation. If you're like, I want to hear this again, I want to ask more questions, don't hesitate to participate again in a subsequent webinar.